What steps can accelerate a Parkinson's clinical diagnosis? Imagine catching a subtle sign of Parkinson's disease before it fully takes hold. Early detection can make a big difference in managing the condition. To speed up diagnosis, healthcare providers focus on recognizing initial signs, using advanced tools, and following up carefully. The first step is paying close attention to early warning signs, known as prodromal symptoms. These can include slight tremors, changes in gait, or subtle handwriting changes. Sometimes, these signs appear months or even years before a formal diagnosis. Researchers have developed machine learning models that analyze clinical data to spot these patterns early, helping doctors predict Parkinson's sooner. Next, a specialized clinical evaluation is essential. Neurologists trained in movement disorders review the patient's medical history and perform detailed neurological exams. They look for characteristic motor symptoms like tremors at rest, muscle rigidity, slow movement, and postural instability. Since early symptoms can be confusing or overlap with other conditions, doctors often schedule regular follow-up visits. Watching how symptoms evolve over time helps confirm the diagnosis and reduces uncertainty. Emerging biomarker tests are also promising. These tests analyze spinal fluid or skin samples to detect abnormal protein clumps called alpha-synuclein, which are linked to Parkinson's. Although these tests have shown high accuracy in research settings, they are not yet standard practice everywhere. They could, in the future, help identify at-risk individuals before symptoms appear, allowing for even earlier intervention. Advanced imaging techniques like dopamine transporter scans can support diagnosis when clinical signs are unclear. These scans visualize dopamine nerve activity in the brain, helping distinguish Parkinson's from other movement disorders. While not necessary for every diagnosis, they can provide extra confidence in uncertain cases. Technology is also playing a role. Sensors that measure tiny muscle vibrations or movements, combined with machine learning algorithms, are being studied to detect Parkinson's objectively. These tools analyze motor patterns and could someday help identify the disease early and differentiate it from similar conditions. However, most of these methods are still in research phases and not yet part of routine diagnosis. Participating in clinical trials is another way to accelerate diagnosis. Early identification of Parkinson's allows patients to join studies testing new treatments aimed at slowing or stopping disease progression. These efforts depend on accurate prediction models and biomarker tests to find suitable candidates quickly. In summary, speeding up Parkinson's diagnosis involves being aware of early signs, utilizing specialized neurological assessments, exploring new biomarker and imaging tests, and leveraging innovative technology. Regular follow-up with healthcare professionals remains vital because Parkinson's can present differently in each person. Combining these approaches can help catch the disease sooner, opening the door for earlier management and participation in promising research. Always remember, if you or someone you know notices early symptoms, consulting a healthcare professional is the best step forward.